Hello and welcome to the third episode of AMSP series Dokie Talkie. In this episode, we tackle about certain topics in line with the Department of Health's 2024 monthly health celebration featuring esteemed medical experts from 𝗷𝗶𝗆 as they provide insights into their respective fields. I'm your host, 𝗕𝗏𝗍𝗂.
And I'm 𝗵𝗲𝗿𝗀.
And we are your hosts for today's episode.
And today we have a very special guest coming all the way from Singapore. He practices adult cardiology and specializes in heart failure.
Our orphan brother from AMSP 2010.
Dr. Francis Emmanuel Tulod.
Thank you.
Welcome,
Thank you for inviting me to this talk. It's so nice to be here and to share awareness to the people about our topic today.
Yes, indeed, Doc. And I'm sure that today's episode is very relevant, especially now that we're talking about love, the month of love. So, what do you think about our topic today?
I think since it's about the heart, so I think since Doc is specializing in heart failure, then I think it's heart attack, Mary.
Yeah, definitely. How about you, Doc? What do you think about our topic today?
I totally agree with you guys. It's a good topic to discuss. Basically, heart attack, or what we call medically is myocardial infarction. It results from myocardial cell loss secondary to imbalance in oxygen supply and delivery. So currently, there are a number of international societies having a joint criteria for establishing the diagnosis of myocardial infarction. The universal definition of myocardial infarction is classified into 5 types, depending on which these circumstances occur. First, you have your type 1 myocardial infarction or your spontaneous MI, which typically occurs in the setting of a plaque rupture, which commonly exhibited among patients who are having this ST elevation MI. Your type 2 is there is myocardial imbalance. It is exemplified in a setting wherein there is hypotension or shock states, where there is imbalance in myocardial oxygen supply and demand. And then you have your type 3 MI, in which a patient died already, or there is symptoms suggestive of ischemia, but there is no cardiac biomarkers available documenting its presence. And you have your type 4A myocardial infarction, which is PCI or percutaneous coronary intervention related. And you have your type 4B, which is instant thrombosis. And you have your type 5, which is related to coronary artery bypass graft. These are the universal definition of myocardial infarction.
Oh my God, Doc, that was a lot you Doc to take in, especially since as a second-year medical student, we haven't touched that yet.
Okay, I see.
It's really nice to know you, Doc, that you shared to us and to our audiences at home. So from your experiences, Doc, how often do you encounter patients who had heart attack or having a heart attack?
Basically, this is one of the most common problems. Globally, it is one of the major public health concern, and acute myocardial infarction tops the list among cardiovascular disease and has the highest rate of mortality, about more than 10% based on health facility records in the Philippines. Okay, and then your ischemic heart disease presents either with chronic coronary syndrome or acute coronary syndrome. And the spectrum of your acute coronary syndrome includes your unstable angina, your NSTEMI or your non-ST elevation MI, or your ST elevation myocardial infarction. And 12-lead ECG and cardiac biomarkers such as your troponin I are essential in diagnosis or determining these types of myocardial infarction.
I wanted to clarify, Doc. You mentioned that your type 3 type of myocardial infarction, you don't have biomarkers.
Actually, patient has already died with presence of signs and symptoms suggestive of myocardial ischemia, but there are no biomarkers available at that time. So it's like undocumented biomarkers. So, but the most likely patients died of this kind of heart attack.
So how
by
do you
definition
diagnose that type of myocardial infarction prior to their death, though?
I think it's more of the history. There's no laboratory evidence that there's no troponin I documented, or any other cardiac biomarkers of myocardial necrosis.
So these patients are like already on the road to death?
Yeah, so basically they're already expired. But there's no documentation, anything of any myocardial evidence of necrosis.
So it's kind of like no cause myocardial infarction.
it's not really no cause because the patients initially will present with signs and symptoms of myocardial ischemia. Chest pain, short of breath, which is acute in onset or increasing in severity for that matter.
Ibaw ka, Doc, like, I really love drinking coffee, Jud. Pero I get these palpitations so much. So, like, how do you differentiate palpitations with the signs and symptoms of a myocardial infarction?
Oh, okay, I see. If you or any other patients who are avid coffee drinkers, I don't think they will have these problems of palpitations. And then actually your symptoms of myocardial infarction, especially in acute MI, which it should be differentiated in patients with chronic coronary syndrome. So they will present as sudden onset of pain or symptoms, or even with minimal exertion lasting for, let's say, about more than 10 minutes duration. Secondly, there is a severe onset of chest pain, discomfort, or pressure in the chest. And also, there is an increasing severity of angina, increasing in frequency and its duration. And it may even awaken the patient from sleep, or most of the time, there is no obvious precipitating cause of the angina, as it may occur during physical exercise or during psychosocial stress.
Well, you heard that, guys, psychosocial stress. So, dapat diligent ka ma-stress.
So, Doc, we have prepared this set of questions also from our listeners at home. So, maybe you can pick one
okay.
at a time.
We can read them out for you, Doc. So, one of our viewers asked, for someone that has already gone through many patients, what would you say are the difficulties faced when managing someone that has survived a heart attack? And have there been any changes in management and treatment over the years?
For someone that has already survived heart attack, one of the major challenges is most of the patients I have seen, or their main concern is the cost, because those patients really need those antiplatelet or your statins medication as preventive medications or anti-ischemic regimens. And these medications are costly. That's one of the major reasons. And then second is about compliance. So as much as possible, we focus on those medications that are really needed to the patient, whether these medications will optimize their cardiovascular outcomes. And then currently, it's of the fraction of acute coronary syndrome. In terms of changes of the management, there have been already like improvement in revascularization strategy or improvement in the medical therapy. So that's why the fraction of this ACS, it's the end-STEMI that is continuous to be increasing, whereas those of ST elevation continues to decrease. Probably mainly because first, there is already wider coverage of preventive measures such as antiplatelet, statins, weight loss program, or even smoking cessation. Secondly, there is increasing prevalence of diabetes and CKD. And lastly, more and more of these cardiac biomarkers at a very high sensitivity rate of myocardial necrosis.
It's very well said, Doc.
Very well said, actually.
And considering that we're also talking about in second year, Doc, like we're talking about history taking, compliance. So like, with what you said, we now see the importance of.
Second question, Doc, from our audiences at home. How does one's life change after getting a heart attack? Or are they able to go back to their normal lives, Doc?
Okay, definitely they can always go back to their normal lives. For me, I think it depends on after this acute heart event, some patients can definitely go back because they will suffer only a minimal LV dysfunction, or others may suffer a bit because of the degree of the myocardial injury, which affected most of the myocardium. So it's case to case, but yes, definitely they can go back to their usual routine. But however, it's very important among these patients to highlight the importance of secondary prevention, like medication compliance, especially with the antiplatelets, risk factor modification, and then also like close follow-up among these patients. And by right, these patients suffering from acute MI at the onset and have been revascularized, by right, we should expect some degree of myocardial recovery. Okay. And then it is very important to identify risk factors, especially hypertension, diabetes, smoking, and obesity, as these are very important or very critical for preventive measures and starting therapy at the precursor stage to prevent signs and symptoms and optimize cardiovascular benefit.
Other than meds, doc, like what would you suggest is a good way to manage these high risks? Like in case, like for example, if you have high cholesterol, what's a way we can do to prevent even higher cholesterol other than just medication?
One way is to promote active lifestyle and also diet modification. Healthier diet, less on red meat, Mediterranean diet.
So Doc, this is quite famous na now sa internet. Kanang
𝗵𝗵𝗃𝗃?
yeah. So is that kanang contributes to kanang as a risk factor, Doc? Like as you said earlier, lessen red meat.
Yes, doc. Actually, I was shocked when you said
Actually, I'm not sure on that. Me myself, I'm guilty because I like 𝗙𝗟𝗄𝗏. No, actually, I mean for primary prevention among healthy individuals, for me, I think it's one of the best ways to have this active lifestyle and eat everything in moderation. Avoid smoking, as much as possible, avoid alcohol. So, I mean, in terms of that, yes.
How about mukbang sa Doc? Kasi kumain ka sa mukbang. Yes, Doc. Nasa report I've read in the internet leads to kanang Doc, stroke or heart attack.
Yeah, I mean,
grabe amount of food in a certain amount of time.
Yeah, I've witnessed some episodes of mukbang episodes. Yeah, I mean, they're eating so much.
Yes, no.
I don't think that's already will add any physiologic benefit. Yeah. So I think everything should be in moderation for prevention of cardiovascular disease.
So when you say smoking, doc, that also includes vaping, right? Or
Yes, that includes vaping also.
vapors out there, watch out. So we have one last question for you, doc.
Wow, so many questions. I'll try my best to answer.
Sige, Doc.
Okay. I work in a sedentary setting. What can I do to be able to prevent having a heart attack? And what are the major risk factors for a heart attack?
In healthy adults, the recommended regimen currently is that moderate intensity activity for about 150 minutes per week or 75 minutes of vigorous activity per week. And then, as I've said earlier, that identification of risk factors at the onset, I mean, especially for those asymptomatic patients like hypertension, diabetes, obesity, or those who are smoking, I mean, identification of these for preventive measures and starting treatment at this precursor stage to prevent development of signs and symptoms and optimize cardiovascular outcome.
What is it you said, doc? 150 minutes of just pure
I
active
mean,
lifestyle?
moderate intensity activity per week or most days of the week,
Wow.
like 5 days a week.
How do you apply that, doc, for like med students when we're literally studying for hours on
Like
end?
8 to 5, Doc.
I mean, to begin, use stairs rather elevator.
Yeah, that's so true.
That's so true, Doc.
Okay, we should start climbing the stairs.
Yeah.
Take note of that, guys, that even just 150 minutes of exercise can already change your life and prevention of myocardial infarction.
And avoid sedentary lifestyle. I mean, that's the main goal.
So don't keep
Be
sitting
active.
down, stand up if you have to. So maybe you might have other questions.
Yes, Doc. Maybe a tip lang guru, Doc, for our audiences. What
Sure.
can you do, Doc? As a example, you're not a medical student. Thus, you witness someone having a heart attack. So what
yes, Doc.
should the first thing that you should do, Doc, to help that patient?
I mean, so is the patient in arrest?
Yes, Doc.
So if you can see an arrested patient, I mean, all of us, even from the medical student, we're all trained to have this BLS training, right?
Yeah.
So it is important that we help those patients, and most important, if any of those patients or you know someone who have those aforementioned symptoms I just have said, for acute coronary syndrome, it's important to remember that time is muscle. So we must bring them to the nearest emergency hospital to optimize cardiovascular outcome so that they can be revascularized soon.
Time is muscle, guys.
The sooner that we can save, the more muscle we can save also.
Okay. Time is muscle. Remember that. That was such a fruitful discussion, Doc. I'm so informed now that myocardial infarction is just not about ischemia, but there are like 5 types. So
Yes, Doc.
Yeah.
Yeah, diba?
I didn't know about that actually.
Me, Doc.
Thank you also for having me here and for this sharing the opportunity to increase awareness for World Heart Day.
Actually, it's Valentine's
Day. Oh, I'm sorry.
So, any last words, Doc, you might want to say, especially to our non-med viewers?
The important thing is that identify these symptoms early and then have them appropriately timed referral in the nearest into any cardiologist or any hospital for that matter. And then identification of symptoms, even identification of risk factors is very important to optimize cardiovascular. Okay?
Thank you so much, Doc.
And that's it for today's Dokie Talkie podcast episode. Thank you also to our listeners for tuning in to our Dokie Talkie. And take note, guys, again, time is muscle. So if ever you do encounter patients that are suffering or might be on the road to myocardial infarction, just remember the advices that Doc Francis told us.
Yeah.
So we hope that you guys will tune in to our later episodes, and we hope to see you then.
So still, a huge thank to our Alphan brother, Dr. Francis Tulod, for his very, very insightful knowledge about heart attacks. So we hope you enjoyed our discussion and found it as enlightening and engaging as we did. And like always,
𝗷𝗲𝗆
proud to be! We'd like to thank our sponsors for today's episode, Dr. Coffee.